So hi everyone, I'm Stephanie Alonso. I am a licensed clinical social worker at the University of Chicago Medical Center. So thank you all for having me here. We are going to talk about mesothelioma and mental health. Hopefully at the end of this, you'll be able to understand what anxiety and depression are, and the impact that they can have on someone as we're going through a cancer journey. So at the point of diagnosis, during treatment, and after, whatever after, may look like. So in the spirit of this not being the most ideal time to present, I thought we would start with a little bit of a breathing exercise. So you may have heard of box breathing before. Essentially, it's in for 4, hold for 4, out for 4, hold for 4. If 4 seconds is feeling difficult for anyone, you can do 2, 3, whatever works for you. And if you're at home and trying to use this, if it's feeling hard to get those deep breaths, you can always try to breathe in front of a fan, but we'll talk a little bit about that later. So let's just start. I'll wait for my little timer to go. So in, hold, okay, so hopefully we're all feeling a little bit more grounded. Thank you. That was as much for me as I think it was for you. So we can get going. So before we can talk about, anxiety and depression, we have to recognize how cancer impacts someone. And the truth of the matter is that it affects your whole person. So if you're a student, if you have a job, your role within your family, your goals for your life, a cancer diagnosis can touch any of those areas. Getting a cancer diagnosis can create or exacerbate any psychological or social problems that you may already have. So maybe you were already someone who was dealing with anxiety. Getting this cancer diagnosis may add to that. Maybe you were someone who was already struggling to make ends meet. This cancer diagnosis is certainly going to add to that. Every person through their cancer journey is going to have a unique experience. Based on your type of treatment, if you're only going to the hospital once a month for immunotherapy, that's going to have different stressors than if you have to come for daily radiation for 8 weeks or something. Your personal stage of life can be impacted. So if I'm a young parent and I'm juggling school drop-offs and homework and all of those things at this current stage in my life, my stressors and my concern are going to be different than if I'm a senior who's maybe widowed and I don't really have a lot of support in the home. They may have different concerns. Your type of work, if you're someone who works at an office, maybe things can keep going, as usual. If you're a construction worker, that may be different, and you may have to think about how you're going to keep doing your career while you have this diagnosis. And then just some of the other general ideas, like having cancer comes with taking time off work, medical bills, new appointments, lots of demands on you. So what is anxiety? It's a feeling of dread or fear or worry. We've all experienced anxiety at some point, whether that was test-taking anxiety, anxiety for a new job interview, anxiety giving a presentation at a conference. But some level of anxiety is helpful. It helps us grow. It helps us make decisions. And I'm sure there are lots of things in your life that were anxiety-inducing before, and now you've gone through them, and now you can do them easy peasy, no problem. Some of the feelings or the mental symptoms of anxiety are just that you're feeling like you can't stop worrying, you can't concentrate because all you're thinking about is whatever this stressor is, you feel restless, you're on edge, you're snapping at your family. Some of the physical symptoms are poor sleep, headaches, stomach aches. You're having a racing heart, chest pain or chest tightness. You're feeling short of breath. I don't know if anyone's seen the Inside Out movies from Disney. Inside Out 2 came out this summer, and they introduced anxiety as a character. I think that the little illustration kind of sums up how we feel, just like so tense, so frazzled, trying to make it all work, but you really have something else on your mind. Moving on to depression. So depression is a persistent feeling of sadness or a loss of interest in your usual activities. I want to highlight it that it's this persistent feeling. So we've all had ups and downs. We've all been sad. We all go through things. But it's that persistent feeling is when we are coming into thinking about depression. So kind of like our friend Eeyore from Winnie the Pooh, like no matter what's going on, how much fun Winnie the Pooh's having with all his other friends, Eeyore's just always feeling down. A lot of the symptoms overlap. So for emotional symptoms, like I said, you're feeling down, you're feeling sad, you're not able to concentrate, you have lost interest in any of your typical activities. So maybe you were an avid runner or biker. Now you're not wanting to get out there. You're just staying home. You can barely get out of bed. We're feeling hopeless. We're kind of withdrawing and isolating ourselves. And in some cases, there could be thoughts of death or suicide. And then the physical symptoms. So you're feeling tired, just really not in the mood to do anything. You have poor sleep, whether that's not sleeping enough or sleeping too much, similar with your appetite changes. So you may not want to eat at all. You may be overeating, and you might feel achy. Again, tired, have different pains, and just generally not well. When I was preparing for this presentation, I wanted to look at how often anxiety and depression come up for people with cancer. And so some level of psychological changes are detected among anyone with cancer. The rate of psychological distress, so anxiety or depression, is about 20 to 47%. I thought it was interesting that people with lung cancer diagnoses report higher levels of distress than any other diagnosis. And so 1 in 4 people with lung cancer say that they've experienced anxiety or depression. And in one study that I looked at the time of diagnosis, 23% of the people reported feeling distressed, and then that almost doubled during treatment, which was kind of surprising to me, but we can talk about that too. So I want to go into some misconceptions or things that you may hear if you're telling someone that you're experiencing depression or anxiety. Often these can be well-intended from family or friends. They're just trying to help you out. But as the person experiencing them, it may not feel great to hear these. So the first one is you can avoid depression or anxiety. Like, just don't think about it, don't focus on it, and you'll be fine. If that were the case, I wouldn't be here, and I wouldn't have this job. So the reality is that acknowledging and validating your experience and talking will help you get through it. Another one, which I already touched on, is that depression is just feeling sad. Again, it's more than just feeling sad. It's this persistent feeling. It's not going away. Often we'll hear that anxiety and depression aren't real illnesses. Again, that's not the truth. They are real illnesses. They deserve as much attention and care as any other medical diagnosis, and they can be caused by stressors like a cancer diagnosis or different chemical imbalances in the brain. Oftentimes you'll hear people say, if you talk to your doctor about that, you're going to get on medication and then you're going to be this zombie walking around and you're never getting off of it. That's not true. A lot of research suggests that the best treatment is therapy. So, different therapies like CBT and DBT, which again we can get into after this, are the preferred treatment for a lot of these conditions. Other people might say, "Oh, you're not that bad off. You don't need, to talk to a therapist or get medication. That's only for people who are so far gone." And that's just not true. So short-term therapy or medication can be helpful to get through a period of anxiety or depression and get you kind of back to a more normalized state. And then something else that I hear a lot is that, in my culture or people like me, we don't do anxiety and depression. We don't talk about it. We don't think about it. That doesn't happen. But again, the reality is that anyone can experience anxiety and depression. So be open to talking about it, thinking about it, and just acknowledging it is the first step. So we're going to talk about some different solutions throughout treatment, but I have to give my little social work disclaimer. If at any point you're in a position where you're considering suicide, you're considering harming someone else, the box breathing is not where we need to be focused. So you need to get immediate help. That can be calling a crisis lifeline, going to an emergency room, talking with your doctor, talking with your family. That's a serious medical issue that needs to be attended to like any other emergency. But if you're doing better than that, but you're just experiencing some anxiety, we have some different solutions that you can try to employ. So we did the box breathing. There's lots of different breathing exercises. Same with mindfulness, like Headspace and Calm. Those are two good apps. They have paid and unpaid versions where you can learn different skills, learn different tricks to kind of try to calm you down and regulate yourself. There are also different grounding exercises. So I like this one on the screen. It's the 5, 4, 3, 2, 1 exercise. So if you're feeling yourself becoming anxious, getting escalated, pause and then try to find 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and something you can taste. Taking that time will get your mind off whatever's causing you the anxiety and kind of ground you back into the moment. Also try to work through what is causing you this anxiety. So are you feeling anxious because you're worried about your medical bills? Okay, that's something we can control. We can talk about medical bills. We can talk about options. We don't want to just let our thoughts spiral and then you find yourself worrying about everything in your life. Other people like movement. So if you can get up, take a walk, go outside, go on a run if you're a runner, just something to move your body and get your mind off of what's going on. Has anyone here ever heard of Brene Brown? Okay, so yeah, Brene Brown is probably the most famous social worker at the moment. She has lots of books. She had an HBO special, and she has a podcast. And during the pandemic, she did an episode on the FFT. She uses a different F word, but for the sake of this presentation, we'll say the freaking first time. And so it's basically the idea that your first time at anything is really scary. So through a cancer diagnosis journey, there are lots of first times. So it's your first time getting diagnosed. It's your first time going to chemo. It's your first MRI. It's your first time ever having a recurrent cancer. So there are lots of firsts, and the best way, or she gives us some ways to handle an FFT, is first name it. So if you're feeling anxious because you just got a cancer diagnosis, you can say to yourself, this is new. This is my first time ever being diagnosed with mesothelioma, and it's okay that I'm feeling overwhelmed right now. Normalizing it, again, that's that. It's okay that I'm feeling scared. It's okay that I feel overwhelmed. Giving it perspective. So this is really hard right now, but I'm going to get all my information and I'm going to get things together, and it's not going to feel this hard, or it's not going to feel hard in this same way in a few months. And then reality checking our expectations. So because this is our first time, we don't really know what we're walking into. We have expectations. So maybe you're saying, oh, I'm going to work through all my treatment and this is going to be easy peasy and it's fine. Maybe that works. Great. Maybe we need to adjust as you go through. So this is a little bit harder. I'm going to take the day after chemo off. Things like that. And just kind of repeating this process as you go through it. Long-term solutions, talking with your doctor. Again, like I've been saying this whole time, any mental illness is just as valid as a physical illness. So let your team know. You may want to look into a support group, try to find a mesothelioma community of other people who kind of know what you're going through. Some people use medication. I will not get into all of the different medications and options like that, but they are out there. And same with therapy. And so kind of honing in on the different stages of treatment or of this journey. So what's going on when we first get diagnosed? So we can feel shocked, we can feel fear, we can feel confused. Why is this happening to me? You're getting information overload, right? I heard some people talk about that earlier. You go to the doctor, you get all this information. Maybe you're not someone who works in healthcare. I don't know what half these words mean. And then you're asked to make very quick, very important decisions based on this information that you just got. You're deciding, am I going to tell people? Am I going to tell my kids? Am I going to tell my family? Do I tell my coworkers or my boss? And there can be a real sense of a loss of autonomy. You know, we're adults, we are in charge of our lives, and now we have this scenario where they're saying, oh, you have to be at the doctor on this day, even if you work, or, you know, we have all these appointments. And so some things to help respond. I think throughout this whole thing, it's important to think about what has helped you cope in the past. So what has helped you get through difficult situations before? Can we employ those skills to get through this? Gather information for yourself and kind of know yourself. So it's important to ask questions to your medical team, you know, keep a notebook. I'm sure you've heard that. But also know who you are. So am I someone who wants to know every single possible side effect and every scary detail? Or am I someone who really wants to just put trust in my medical team and go from there? Or do I want all that information so I feel like I'm making my best choice? Building a support system. So that may mean getting second or third opinions, even if that just brings you back to your first doctor, but you're feeling validated. Family and friends, know who you can trust and who's going to be there for you and not add more stress to this experience. And again, finding a community within your diagnosis. When we get to the point of treatment, what's going on? So now we've kind of got things settled. We're actually getting our care. We're having to take time off work. Again, going back to the medical bills, we have concerns about bills. We have concerns about, again, taking that time off work. How am I going to pay for all these new things, these prescriptions? We may have outward changes. So if you have lost your hair, or if you're using a walker or a cane or oxygen, things like that. Some people feel like you fall into a routine of treatment of like, okay, I know I have to come every 3-4 weeks, whatever it is. And some people experience feeling isolated during treatment. So what can we do when we get there? I think first and foremost, use your resources. Again, this is your first time going through this, and it's a very stressful situation. You are not on your own trying to navigate all of these things. So a plug for your medical center social worker, talk to them. They may be able to help you with a variety of topics, tell you what your medical center has to offer you. But I also always mention Triage Cancer and Cancer and Careers. They're just two amazing organizations. They can tell you about any legal or social issue related to having cancer. Cancer and Careers is exclusively an organization that helps people who have cancer and a career. And they help caregivers too, just knowing your rights. So definitely look into those. But yeah, like different financial assistance programs, different disability options. You shouldn't just know those. So you want to reach out to the people who do. In terms of communicating needs, I think that can help with addressing some of the isolation. So our friends and family might say, oh, reach out if you need anything, and then you don't hear from them. So it's okay to say, hey, it would be really helpful if you could pick up my groceries, or if you could give me a ride to treatment on this day. Being specific gets your needs met. It tells them what you need, and then they can feel like they've helped you out. And again, as you can see a theme, lean into your mesothelioma support. So moving into survivorship and cancer as a chronic illness. So, knowing that you have a disease that doesn't have an immediate cure is not always the easiest thing to come to terms with. We have to focus on living day to day, focus on the now. Some people might have fear of follow-ups after treatment is over. I also heard someone kind of mention that or reference that earlier. It may be stressful to be back in the same place where you got your diagnosis or got your treatment. And people also mention just ongoing decrease in support. You know, a person who's not going through cancer might think, oh, your chemo's done, great, you're all set, like you're back to normal, and that's not maybe the case. Has anyone heard about scanxiety? Yeah, so scanxiety is definitely an important topic that comes up. So it's scan anxiety. Lots of the symptoms are the same as anxiety, like we talked about before, but it's just the fear and the stress related to getting a scan, typically before you get the results. So before the scan, you know, obviously you're thinking, or you could be thinking, what's going to happen? Have I recurred? It's taking you back to that initial diagnosis time. During the scan, it just might be uncomfortable. You know, you're on this hard bed. You might be in a weird position. It's cold in there. Sometimes you're closed in. So that's not comfortable. And then after the scan, again, you're just worrying about those results. So some tips to manage scanxiety. Before your scan, try to schedule it in the morning if you can. I know that's not always possible, but that way you're not worried all day. And if there's anything like you can't eat or drink, you're not going all day without it, adding to your stress. Ask your medical team questions that'll help you feel prepared. So maybe you want to know, do I have to get undressed? Am I going to have to not eat or drink? How long might I be in the room? That way you're feeling empowered when you go in, you know what you're getting yourself into. Sometimes if we're really struggling with anxiety before a scan, that's okay. Your doctor might give you some medicine to help you kind of calm down. So you can always talk to them about that. And again, just sharing your feelings. Don't keep it all bottled up. During the scan, talk to the person giving you your test. You may be able to practice some of the mindfulness activities we talked about, like the breathing. If you can't do breathing, maybe you try your meditation skills. Sometimes they can play you music, just different things to help you relax. Bring someone with you. You know, they may not be able to be in the room with you as you're getting your test, but knowing that there's going to be someone in the waiting room for you after can be really reassuring. After the scan, try to follow up with your medical team. I know where I work, a lot of times people can see their doctor in the same day, so it's not super drawn out. Bring someone with you if you want someone there to get those results. If it can't be the same day, try to keep yourself busy, stay on your routine. Don't let it get you, too bogged down. In the chronic illness stage, we also think about death anxiety. So I think it's natural for anyone to think about death, but certainly when you have a serious cancer diagnosis, it can come up. Some ways to work through that are engaging in normal death-related activities. So even without a cancer diagnosis, as a social worker, we should all have power of attorney documents in place. We should all have wills in place as adults. But if you haven't, that might be what's causing you some of your anxiety, knowing, oh, I have to get my things together. So work on that. Other people will try to do different like legacy projects so that your family has, important things or ways to remember you. Like some people will film videos for their family. Some people are more artistic and they want to do like scrapbooks or handprints. We see these like hand casts a lot. And again, just talk with your doctor and your therapist. They can help you work through it too. Some other ways to get help. So I can speak for our medical center at the University of Chicago. I don't do individual counseling with people, so I kind of help with more like one-on-one interactions. If you have a specific question or if you're having a hard day in chemo, I can come up. But we have a whole team called psycho-oncology. So we have psychiatrists, psychologists, social work therapists who specialize in mental health as you're going through a cancer treatment. So definitely ask your medical center what they have or who they refer to. Other community organizations can be really helpful. So Gilda's Club is a national organization, but they have different like clubhouses. So in Chicago, there's one here in downtown. They do so many amazing programs. So they have support groups, they have educational events, they'll have physical activities like yoga or mindfulness. It's for Gilda Radner, who is on SNL. So they have improv classes. Like they have so many things that you can really tap into. They're all free and they're open to anyone impacted by a cancer diagnosis. So patients, family members, healthcare providers, whoever. There's also lots of national and online resources. So the American Cancer Society, they have lots of tips. Immerman Angels, they're an organization that'll match you up with a peer mentor. So maybe they find someone with a similar diagnosis who's a little bit ahead of you in treatment, who can kind of be there and say, oh yeah, I know what you went through. I got the same chemo, stuff like that. Obviously, the Mesothelioma Applied Research Foundation, they have support groups. They have lots of helpful information on their website. So definitely try to tap into your resources, see what you can come up with. I think being curious and reaching out for help is the most important thing, though it may not always be easy. So that is my presentation. I don't know if we have time for questions, but if you have any and we can't, you can always shoot me an email. I'm happy to share these slides. I have some references to go more in depth on some of the things we talked about. Some of them are more academic journals. Other ones are just, more helpful tips on like the breathing and the mindfulness and stuff like that. So thanks.